4, 3, 2, 1, go.
All right, we're ready. Okay, hello, welcome everyone to our second task force meeting. And we're going to be focusing on language acquisition of deaf, hard of hearing, and deafblind children in the state of Arizona. So the task force meeting is being facilitated by ACDHH under the state of Arizona law. It is a wonderful group of people here with a variety of backgrounds, various agencies, also community members, and we have a great first task force meeting last month. Rather, we had a great first task force meeting last month, and now we're on our second meeting. So we got to go through a few ground rules, expectations, and review why we're doing our task force, etc. And then we'll dive into our subcommittee reports and share all of that information and work together for the success of our task force meeting. Just giving you guys a second to look at these ground rules. So this is just to ensure access, that everyone can have access and fully participate in the meeting. So if we want to review these rules, if you have a comment or a question, you can raise your hand. And we will have opportunities for sure to collect the information from everyone to review everything. We'll have plenty of time for our discussion today. The meeting is scheduled from 10 to noon, Arizona time, but we might finish a little bit earlier. If we finish with our agenda, we'll see how it goes. So I want to make sure, Jeremy, our live stream is recording and we're all set. We're on the record now.
Yes.
Okay, excellent. Thank you. So as a reminder, we do have captions available. And on the bottom, you see the little live captioning logo. It actually says live transcript, but you see the closed captioning logo. You can open that up and you'll be able to get a transcript or captioning. We also have ASL interpreters for those who need access to visual language, or we can have, and they're also providing a translation into English. So when you raise your hand, we will ask you to turn on your camera at that point, and we'll need to turn off the PowerPoint to make sure that everyone can communicate easily. Okay, so just to review, this is regarding SB 1092. The goal is to establish a task force with diverse community members and partner with various agencies to see how we can establish a language assessment process for deaf children in Arizona. So it's going to be due in June. That's our timeline that's coming up. This is the agenda for today. So just reviewing our timelines, and then we'll have an opportunity to check in with the subcommittees and get updates of all of the subcommittee information, see what we've got from all of our community and other subcommittee representatives. And our subcommittees are going to report in and talk about who their facilitators are, talk about who their roles are, talk about what goals they have for their next meetings, and hopefully we can get a bigger picture of what every subcommittee is up to. And we're going to review, after we do our subcommittee check-ins, then we are going to have an open forum for everyone to talk about the different things that subcommittees brought up, talk about sharing resources, or talk about how each other's subcommittees information can support the goals of the others. If we have any questions or concerns, we can use that time during the open forum to talk about those. All right, so we're gonna I'm going to show you the timeline next. So during the subcommittees, we have, these are the subcommittees that we have, rather, pardon the interpreter. Oh. I froze. Okay, it looks better. Sorry, my video froze. So these are the 3 subcommittees that we have: demographics and data, systematic connections, rather, and assessments and review. So we're going to encourage the subcommittees to meet once a month between the task force meetings. So the goal is for the subcommittees to collect information, develop that information that can benefit the whole group, the whole task force, and make recommendations. So this is the timeline. January, ACDHH worked pretty hard to figuring out who should be on the task force and inviting the people that we need to have here. And ACDHH staff started talking about making sure, we got all of our invitations and everything was ready. So February, we had the first task force meeting, and now here we are with the second meeting. So this is what we're doing on our timeline. We have some of the drafts of information so that we could start filling in information from subcommittee discussions for the next task force, and each one will go dive a little bit deeper with what is found. So we're going to be developing this agenda with feedback from the subcommittees, and with the discussions during the forum, we'll finalize that and make recommendations. Once we're finished, we will make recommendations to the state. And we're going to switch interpreters to Beth.
I'll let you take a look at each of these that the subcommittees will be working on. And either, interests and things that people are motivated to research more. It'll be information and skills that'll be beneficial. You'll see the members of each task force listed here, and where they're from and their knowledge background. You can see we have several people that are represented here in different agencies. A lot of people are involved in deaf education in the state of Arizona. Wow, it's just really great to see all of us come together, share our considerations, our thoughts, our wisdom and advice. Really have people for providing family perspectives. It's very important to recognize all the cultural agencies that are involved here as well, the diverse population that we have here in the state of Arizona. It's very nice to see underrepresented communities represented here. And I just think it's important to keep in mind the family backgrounds and the people that we serve here in the state of Arizona. So we just want to make sure that we divided these subcommittees in different groups to make sure everybody's representative equally here. And I know that there is a lot of heart here with the people that are involved in these subcommittees, and there will be a lot of brainstorming, and that will be very helpful to the entire task force. So we'll go ahead and do the subcommittee check-ins right now. Since we've already reviewed the PowerPoints, and we can copy any questions into the chats. I I can go ahead and take the PowerPoints down. Once the subcommittee starts, we'll do the assessments and review first, then data and demographics, and then we'll do the systematic connections. So we'll go ahead with those subcommittee check-ins and we'll see what's happened. If there are any questions that are copied in the chats, I'm hoping that someone will take notes and we can have those to work from later on.
Hi, my name is Caroline Naylor Oglesby. I am the facilitator for the assessment review subcommittee. And our note takers are, well, we've identified Christy and Jennifer as note takers. So I wanted to give an overview in regards to our.
Okay, oh wait. Okay, Tawny was just setting up everything here. Okay. Okay, go ahead.
I'll start over. Hi, I'm Caroline Naylor Oglesby. I'm with Arizona Early Intervention Program. I am in the assessment review subcommittee. I'm the facilitator, and we've identified Christy and Jennifer as our note takers for this subcommittee. We met for our first time yesterday, and the interest of this committee, we're going to be focusing on assessment used for children who are deaf and hard of hearing, and looking at all of the different assessments that are used for the 0 to 3 population with ASA, 3 to 5, the special needs preschool, and K through 12th grade. So that's our task in regards to looking at the assessment tools, looking at if they're standardized, how are they administered to children in this population, and then also if there are any suggestions or recommendations about the assessment tools that are used, what that would look like, and planning out if there is any additional training or support that's needed, and guidance for the programs that are using any particular tools or other tools that we would suggest. And we are scheduled to meet monthly. Our next meeting will be March 23rd from 3 to 4:30 p.m. So any questions for the larger group? Thank you.
Beth, you're muted.
Sorry. So now the data and demographics subcommittee, it's your turn now. And thank you, Caroline.
Hi, everybody. I'm Kendra Benedict from ASDB. As of an hour ago, I'm the facilitator of the data and demographics subcommittee. And Fran Altemeyer, as of an hour ago, has been voluntold to be the note taker. We met, like I said, an hour ago. Fran, myself, Susie Perry from the Department of Ed, and Jesus Marquise, a parent advocate. We met to briefly talk about what types of data we need to be gathering, where we can go to find that data. We talked about the need to know more about what everybody in the subcommittee and task force does, so we know what our in-house resources are to find that data. Tawny, that slide you just shared was very helpful. That will help us to that end in identifying who we can go to for additional information. We talked about the need to really narrow in on our focus, because this topic could literally lend itself to a dissertation. And so we need to be really clear on what population it is that we are looking at. I also brought up the fact that, you know, in this field, we tend to focus very narrowly on children who are deaf or hard of hearing without additional disabilities and who are progressing not at a rate that we would hope because they've had language deprivation. And in doing that, we are leaving it out a huge chunk of the population of deaf and hard of hearing children with severe medical needs or other disabilities. With that said, again, it's important to narrow in on what it is that we're doing here, but I think we would be doing the field a disservice if we did not at least recognize that group who may be communicating in other ways using augmentative communication, assistive technology. We have to at least make recognition that that group is there and needs research as well. I just don't want to proceed without even acknowledging that, but that might be out of the scope of this task force. I understand that. And so we are just, for starters, starting a Google Doc to share all of our questions so we can categorize them, narrow down, and then start to reach out to have our questions answered. Between Fran having access to the Department of Health information, newborn hearing screening, myself with ASDD, and Susie with ADE, and Jesus as a parent advocate, knowing many different organizations around the state, we feel that with our network, we can gather a lot of this information, but we recognize that a lot of the data that we may be collecting isn't the quality of data, say, that you would be publishing somewhere. There are gaps in the data that we'll be collecting. We already know that. Even Susie shared some information about data they have from the Department of Ed and the number of preschool children exiting preschool, going to kindergarten, identified as deaf or hard of hearing. And we all immediately identified that those numbers were way off. She only had, there being, I think, 35 kids last year going to kindergarten. And I can say that from PTSD alone, we had 20. So, but we recognize that's why we're all here. We're here to identify where these gaps in our data collection exist and how we can go about making that data better. Fran, anything I missed? Does that sum it up?
Yeah, I think you've got it.
Okay, thanks.
Thank you.
Thanks, everyone. If you have any questions, please feel free.
Great. This is Tawny. Great. Thank you for sharing the information. And it seems like you met just an hour ago. That's great. Good work. I'm curious if anybody has any questions for the larger group. Okay, I guess not. So we'll go on to the third subcommittee, the systematic connections.
Hello, I'm going to be serving as the facilitator for the Systematic Connections Subcommittee. We also met yesterday for the first time, and we spent our time discussing all of the agencies, all of the professionals, and the roles that those agencies and professionals serve when it comes to diagnosing hearing loss and making referrals and connecting families with the services that they need. So really, we spent the time gathering information, sharing resources, and sort of educating each other about what the Part C process looks like and we briefly began to talk about how families and students are connected with resources under Part B. So I have some questions just about the subcommittees in general. I'm wondering if we are just supposed to be gathering information, or if we're supposed to be working on any sort of deliverables. You know, as a facilitator, I want to be sure I'm doing my job. So I want to make sure we're working on all the necessary things.
Okay, this is Tony. I'm taking notes here. Great. So okay, hold on. The interpreter needs Tony to be a little bit bigger. Okay. So that's a really good question, Molly. Yes, I would agree that we do need to have a picture of what the deliverables might be. And for your committee, I would like to see a roadmap, like where we see where we have newborn babies that are definitely not identified until later, and their journey through the system, like until they're 21 years old, right? Because they're still in the educational system at that age. So that's what my hopes are for your subcommittee. I'm hoping that gives you a little bit of an, you know, idea of what to play around with. Oh, okay. I've noticed Jesus's comments that the screens are small. So if you could change the video up in the right, gallery view will be so small, but if you can do, if there's no person in there, under the view, just to go into speaker, and then maybe you can see the picture. And on each person's thing, they have a picture thumbnail, they have 3 dots. And you can do hide video participants if that maybe helps, or you could pin me either. So there, you can do that by clicking on the 3 dots on each thumbnail of the person and find those. Does that help? And we're going to switch interpreters now to the
Okay, let's see. It's in the corner. Let's see. Maybe that would help. Did that help? You can go to if you see the 3, you should see 3 videos, me, Molly, and the interpreter, Wendy. Do you see the 3 of us? And then if you see the other ones, click on any one that has a video going on. You can click the 3 dots in the corner, and you should see a menu. And then there's one that says hide non-video participants. And hopefully the tech team can talk with you in chat to help you with that. Because it is important to have it accessible for sure. Okay, so we're going to continue our video check-in and make sure people can see the interpreter. Maybe everyone can see everyone. Okay, Molly, did you have an idea? So the roadmap, the players, the state players in the process, including possibly alternative paths as well. So for example, deaf children referred to specific agencies and other systems. We want to know that.
Great. That gives me,
So Molly.
yes, that gives me a better idea of what to be working on. Thank you so much.
Absolutely. You're welcome. Okay, so now the other 2 committees, if we can, we're going to go ahead and do a description. As Molly brought up, before we go into the forum, that's a perfect segue. So for the assessment review committee, we hopefully for the list of assessments and what the purpose of those are, focusing on language acquisition. Remember, deaf and hard of hearing kids, it's a good idea to focus on language assessments for deaf and hard of hearing children, narrowing it down only to that, because so we're wanting to look at current ones that are used in the state, the pros and cons of those, and what other assessments we would hope to see as a group, as a subcommittee, we would hope to see more people in the state using, and then collecting data on that. So maybe, for example, assessment that has been being used so far, maybe it's out of date or aged, and we might want to see a new assessment take its place, but we would need to see training happen, or resources or funding, if those need to be purchased. If we can identify the assessments that are currently being used, the pros and cons, and what assessments we would like to see being used more or be introduced in the process of collecting literacy, language acquisition data rather. So if that is, if that links up with what the committees can do, hopefully. Caroline, did you have any questions about that?
No, I don't.
Okay, great. Thank you. So for data and objectives, I think we want to identify what data we currently have. Sorry, data and demographics, pardon the interpreter. To identify what data we currently have. We want to look at maybe raw numbers. We want to see what other information we do have out there, what assessment scores we have, for example, do we have scores for individual deaf, hard of hearing kids? Do we know family demographics? Do we know locations, school programs that are being used? Do we know, recording is going to be a challenge. Sometimes it's well, there'll be good information, but it's not enough to help. And sometimes it's not. Sometimes it's too much data, sometimes it's not enough, but too much data is not a bad thing, but we'll see. We would like to see a summary of the data that we currently have, and maybe identify what data is still needed and what gaps we have. Like was mentioned, there are gaps. Great, mentioning that in your deliverable next time we meet on the task force, we can review the process in that deliverable. Okay. So Kendra, do you have any questions or any things to mention regarding that?
Nope, all good.
Okay, great. So now we'll go on to the open forum. Any questions or thoughts or things we want to share in the open forum? Hang on, I just realized I need to fix my video. Give me a few seconds to change the video. I have to leave Zoom and come back. I have a black screen. I'm not able to see myself on my screen, so I only see myself on the iPad on a separate device. So give me a few minutes to 20, 30 seconds. I'll be right back. Okay, looks better now. All right, I'm gonna get the PowerPoint started. Okay. So any question or topic we feel we want to know that will help support the work of the task force or the goals of the subcommittees, we can talk about. This is kind of just a draft that I came up with, but if there's new information, some of the subcommittees talked about some new information like gaps in data. The 35 kids identified, which you've already mentioned, that's a discrepancy with what you already have, what you already know. So that's a great point to discuss here. So I want to clarify something what the caption says. It says 35. It says it shows 35 deaf students, but one deaf school has 20 registered. So that obviously is a discrepancy. 30 out of 35 kids don't go to one deaf school. That's not possible. So obviously, in the state of Arizona, obviously that's a discrepancy. So we're going to need to work dialed in on that and figure out, that's one data point to figure out. Sorry, that's not what I said. The interpreter misunderstood me. "30 kids going to one school." There can't be 30 out of the 35 kids going to one school. That's not possible. Obviously, there are more than that who are preschool aged. Thank you. That is a better translation. Thank you. So looking this over, we can talk in the open forum. We can close the PowerPoint, and whoever wants to raise their hand and start a discussion about what we've seen so far, we've talked about so far. If we want to hear from other committees, maybe other committees can give some feedback on what your committee talked about. I do see a question in chat. So the question says maybe it's unrelated, and maybe it's an unrelated question, but is the work that we're doing here as a task force related at all to the lead care, the passage of that type of legislation here in the state of Arizona? And the answer is any legislative bill could be discussed related to deaf, hard of hearing language acquisition, but we have a specific bill. There's the EdK, but we're not using that terminology. Arizona did not use that exact model. They kind of went in a different directions. So we established a task force and that's what we're here to work together on as the language acquisition and assessment. So it could be a similar concept, but we did not specifically copy that one 100%, no. So currently we need more data. That's what we're talking about right at this moment. We want to know how our families are doing, what they're doing. So thank you for that question. Any more questions? Go ahead, Fran.
Yeah, so my thoughts related to some of the data might be the need to develop some data sharing agreements so that when we're talking about a number of kids like that 35 that was mentioned, are they the same 35 that we already knew about or that we're tracking, or are they a different 35 than started in our system? So I know for newborn screening, I have data sharing agreements with early intervention. So I can track specific children and where they're at through the early intervention process. But we may need to think about some data sharing agreements between the early intervention and the Part B programs, so that you can follow those same children through their evolution of newborn screening, early intervention, early childhood programs, school age, so that we have a set cohort of children to be able to evaluate those children and their progress over time.
Yeah, that's a great question. So hopefully we'll be able to answer that question. Do we have anyone who can answer that question? Respond to that question, rather?
This is Kendra. I think that is in progress. Susie Perry would probably, or maybe even Caroline could speak to that, but I think that's something that's been in progress for a while now for AZIP and ADE for their data systems to communicate. Caroline, do you know anything about that? I don't think Susie's here. She had to go to another meeting.
Yes, that's something that we have currently in progress right now, sharing data for the children transitioning from AZIP to ADE. But I think it might be helpful if it's any specific data that the group wants to track.
Okay, yeah. Thank you for your input on that. I'm glad there's a process already in the works. Hopefully the subcommittee can capitalize on that and use that in their delivery for as we continue the process. So a lot of other states have the same struggles because, you know, sometimes there are two different systems, two different built-in, two different literally and figuratively, they're just in two different buildings. So that communication sometimes doesn't cross. So if they're following this kid over here, they might not, it might be the same kid and it might not. So adding maybe ID numbers to kids, there's been a lot of talk about that, but we haven't really seen that fly so far.
Yes, and from ASA perspective, that and ADE, our collaboration, that's exactly what we're looking at. Having, when a child is referred to ASAP, they would have this specific ID number that would be used for ADE. Keeping in mind with FERPA and HIPAA compliance, but that way we would be tracking kids based on their ID number.
Okay, I look forward to seeing what can happen with that process. Maybe it would be a good idea for us to review okay, that was better. The interpreter was blurry. So, okay, I think it's a good idea maybe as a group to review the numbers that AZIP on their website and compare that to National Center for the Deaf, you know, that they have there. Oh, sorry. National Center on Hearing Assessments. National Center of the Deaf have different data. So yeah, sorry about that. So yeah, the National Hearing Center. The state's data, there are different websites that have results there that we can also take advantage of looking up the data there as well.
And I want to add that with AZEP, one of our service providing agency is Arizona State Schools for the Deaf and the Blind. So for those of you who are not familiar with AZEP services, ASDB and FBC, Foundation for Blind Children, they collaborate with AZEP to provide the vision and hearing services. So they may have some data as well for the 0 to 3.
Okay, that's good to know. I'm trying to think about one issue that came up at the national level that might apply is the loss of follow-up. From after the newborn screening, a baby is screened in the hospital. It seems like it's possible that they're then referred to an audiologist, and then the audiologist does a follow-up evaluation. It's interesting that the medical numbers of babies that are in the hospital, they seem differently. I don't know, the documentation of those numbers seem like, let's say, for example, maybe 50, there could be different. So they refer 50 to audiologists, but only maybe 30 actually get a follow-up hearing test. So the loss of follow-up would be 20. And that's, wow, that's like close to 40% of the babies that aren't getting that follow-up hearing test. So I think it would be really interesting to look into those numbers, and because that is a challenge, that babies in the hospital, they get their hearing tests, it might be a little bit different. There might be different factors involved, fluid in the ears maybe, or maybe from C-sections, maybe they have fluid in the ears compared to maybe a natural birth. And so that's where I think some of our loss of follow-up numbers might be changing. And yeah, thank you for the comments in the chat. Yeah, so I'm reading that. I'm happy to share that, Fran and Molly. Thank you. Oh, see, this is already exciting. You're already exchanging information. And someone also let me know that Jesus had a question. Jesus, did you want to show your video and ask your question? Okay, hold on. I need to switch. Okay, for language acquisition, I think the numbers seem to be, they should be bigger than they actually are. And should we collect data also from out of state, maybe like at the Gallaudet University, or do you think there are other places that we could collect data, or can we only collect data from here in the state of Arizona? If your subcommittee feels like, other state research, state research from other states could benefit, then you could ask people, other states, like, where did they get their information, the reason that you decided to collect the data. And then you can use that as a comparison as well. For example, Molly just mentioned the numbers of the children, getting follow-up hearing tests after they leave the hospital. That shows right now that how we need the knowledge, and there's some factors that are involved. And other states I know struggle with the same thing. So it's a great discussion for the systematic connections and the other subcommittees to share and share their information. Okay, is there any more discussion or are there any more questions? Okay, so we have the assessments and the data and demographics and the systematic connections. Is there any other information that all three of the subcommittees maybe should know? For example, other states I know struggle with the concept of, home birth. There's been discussion about missing information with families, that don't birth in the hospital or in a birthing center. That we should include home births. The people on the reservations sometimes don't go to the hospital, that are in data sharing. It's important to keep that in mind, and also people who move here from other states, other countries. How is the data kept on them when they're born outside of Arizona? So those are things to consider. That just kind of came up, and so if you have anything else that comes up that we should keep in mind. Okay, well, with the silence that I'm noticing, it seems like you're all very excited to keep working on your subcommittees, and that's great. There's a lot of information that we need to find and collect still. So we'll go ahead and show the PowerPoint again, and then there will be information included on the PowerPoints for the subcommittees for upcoming meetings. And there's a comment shared in the chat. If you would like to read the chat, Fran shared something to Molly there. Not everybody might have access to the chat. So Molly's saying the number of babies born from 2020 that were lost to follow-up was much higher than normal due to the pandemic. We are seeing that 2021 as well, but hoping it will swing back to more normal. The good news is that we've identified a similar number of children with hearing loss as we expect each year. So that's great news. Okay, I will go ahead and share the PowerPoint again, and I'll ask the interpreter to shut off her video so that'll be easier to see. Okay, so as a friendly reminder, the next task force meeting is April 13th. And we're hoping your subcommittees will meet again between now and then and collect more information. I hope that we have more people joining who didn't have the opportunity to join so that we can have a full house next time. And during the discussions, I'm hoping we can get a picture of the deliverables that you're considering and put the information together. We'll have a more in-depth report we'll give 10 minutes for each subcommittee to share their findings, some of the challenges that you're finding in your approaches, and where things are leading to you to find your deliverables. So with that, we'll then after that, the next task force meeting will be May 11th, but April 13th, be ready to share those kind of things. So, and I'm sure that ACDHH staff will work out with the interpreters and share that information so that we have interpreters at the ready. So thank you all for joining us today and your commitment to data gathering and information gathering. It's just the beginning, and I know there will be a lot more thoughts and considerations as the next few months approach. And I wanted to let you know also, this is the last opportunity for your subcommittees, maybe if you know people that have information that can provide your subcommittee more information, you could the close of business day for that would be Friday. So keep that in mind if you're have anybody else that maybe wants to join, if you're considering a person who has a lot of knowledge in the area that your subcommittee is. So there's a committee form that they can fill out, and then if that's so, we can be sent to ACDHH and we'll work it out. So are there any last questions, or is there any last information request from anyone?
Tawny, this is Kendra Benedict. Can I ask a question?
Sure, Kendra, go ahead.
Thanks.
I'm going to take the PowerPoint down first.
Okay, great.
Okay, great. Go ahead, Kendra. Okay.
In talking to some other folks about the task force and about the subcommittees, I'm feeling like there's a lack of understanding, and I'll speak for myself, what the end goal is here. I myself am confused. I think the subcommittees and what we're working on is great, but I'm lacking a full understanding of what are we trying to accomplish at the end of the day on that timeline. When the last bullet point was June, and I can't recall exactly what it said, but something about, I don't know, presenting what we have, like what are this sounds really stupid, but what are we doing? I don't know how else to ask it. I don't know what we're all doing here.
Oh, sure. Hold on. I get Zoom is not friendly. Okay. So that's really great. I'm glad that you shared that question. I'm sure that oftentimes when a question is asked, a few other people have the same considerations. So we are focusing on deliverables to create a report for committees, right? And that report will help us come together as a task force in May and really be able to provide recommendations to the state of Arizona for statewide, including different stakeholders and players that are involved, to make sure that we have a good collection of data for deaf and hard of hearing children and their language acquisition process. So we'll have a list of recommendations that we would like to see set up in process, or we need to do more assessments, introduction assessments, or whatever. So really any recommendations that we can see based on the subcommittees, like where we can identify gaps in services, so that we can recommend how to, correctly collect data or how assessments are done. We're really wanting to be able to make recommendations and based on what Arizona needs are, and we can bring that to the governor and to the government of the state of Arizona, and hopefully set up a system for future legislation. So I'm hoping that will help clarify a little bit.
Yeah, a little bit. Thank you. Like, are we starting off with any assumptions? Do we as a group have assumptions that there is data, there isn't data, what data is there, what do we think we're going to find? Like, ACDHH went to the legislature last year to have this bill passed. Why? What are the assumptions, and what are we trying to determine if those assumptions are wrong or right? Or yeah.
And we're going to switch to the interpreter, Wendy.
Yeah, that's a great question. I will let ACDHH staff respond to that. I was not involved in the bill passage, so I'm here to, after the bill passed, to help facilitate the task force. So I will let ACDHH respond to that. But based on our current discussion, I already see that there's some data gaps, there's some variation in what assessments are being used, and some not clarity about that. And so the goal isn't, it isn't that everyone's using that one assessment and that's the one we want, but it's just there's a variety of those. And the reports to the state of Arizona regarding language acquisition of deaf children, we have 2 or 3 different assessments, so it's hard to compare that data as well, because kids are taking different assessment, being used with different assessments. So the baselines levels are not where our deaf children are and what milestones they're reaching. For language acquisition in general, for children in general, where are our deaf kids in comparison? And we need to know which assessments are being used to help find that information. So the reason, that's the general reason for this task force, but specifically you might have to, this might need to be fielded by ACDHH staff.
Tawny, I'll add to that. If our primary goal is to determine how children who are deaf and hard of hearing are progressing, especially in the birth to 5 range, I would encourage people to go to the University of Colorado's website, specifically their website, and I can put the link in the chat. They have a grant, a CDC grant right now, and some of you may already be aware of this. But ASDB is involved in that, and they are tracking all of our birth to 5 kids progress. Anyone who's at the school for the deaf, that does not extend out to the public schools at this time. But that is one effort that's underway to do that. And so I hate duplicating efforts. It seems like we should probably look at that or bring them into the conversation at some point if that's the primary goal of this group, because that data is being collected. So just wanted to put that out there.
Excellent. So I was aware of that, the federal grant of the University of Colorado, but they are looking at the whole child assessment. They're not only looking at language acquisition. Obviously that data would be beneficial, yes. And I see them using that data in this with the program, the center, and plus for purposes of our committee as well. But we're looking at birth to 5. How do we know the language acquisition? In general, we know, standardized testing does not always identify for deaf and hard of hearing children. We don't always know how they're doing. Are they doing well with reading, or are they doing well with general language skills? Are they acquiring general language skills, whether signed or spoken language or written language? Do we have to specify? So do we want the state of Arizona? That's one of the questions we have for this task force. Do you want me to repeat? So the interpreter was not clear. I wanted to clarify. Okay, so do we know how deaf and hard of hearing children are doing in terms of spoken language, written language, sign language? Do we want to know specifics on those points, or just do we want general information? That's the question for the task force to determine, we as a group to determine.
Yeah, that right there is helpful. I don't know if that had been stated very clearly. And yeah, so thank you.
Sure. Yes, of course. It'll take time to, sometimes we're developing this together. So we're going to go where the task force decides we want to go. So each state and the families that you work with and the children that you work with might be involved. So it's all for the state of Arizona. Well, whatever we feel is best for the state of Arizona. So do we have another question? Another question here. It says, similar to standardized testing, are we looking to recommend a standard test for deaf and hard of hearing kids in Arizona? That's an interesting question because in general, testing, I think, wouldn't be recommended until later, like 3rd grade or beyond. Usually testing applies to those age groups. So assessments, though, could be they could be recommended how data is collected in various systems. So targeting those 3, spoken language, written language, and sign language. It depends on what we're using currently and what the task force feels would be the best idea to start to work on or continue, start going forward or continue doing. So some assessments really emphasize spoken language, but can be modified for sign language. And there are those assessments are not normed or designed or intended for sign language, and spoken language and sign language are very different. So in terms of vocabulary, in terms of grammar development, they're different. And so that means we could you find challenging myself as with a 2-year-old, teaching a 2-year-old, I find those challenges to be important. And sometimes when you try to deliver those assessments and you bring those kids and you have maybe a kid who came from another country who's 10 years old, and those assessments don't really apply to that language level and that age at the same time. So those are some of the struggles that we can encounter. So standardized testing, I'm not sure about that. Again, that's up to what the committee feels is the best recommendation for the task force as a whole. But if we're focusing on one assessment, or if we're talking about depending on age or depending on language use, there's a variety of options. But it's important, the important thing is what we see happening currently in the state of Arizona, what's being done in schools and at home, and what we feel will give us the clearest picture of what kids are doing related to language acquisition currently. And Jesus asked, who sponsored the new bill? Do you mean the new bill, the one, the SB 1092 is the one that's the task force is based on? Is that the new bill that you mean? Okay. I actually am not aware of the answer. I don't know the specifics. I will let ACDHH staff chime in and respond to that with that information. I don't know. They might have to look that up and add it to chat. I will let them reach out to you directly with that information. So are there any more questions that we need to discuss? All right. I'm waiting for Nikki to respond to Jesus's question, but other than that, are there any other points that we want to talk about? If you want to raise your hand and let us know. I have a question. At this time, do we know, does anyone on the task force know how many deaf or hard of hearing or deaf-blind children there are in the state of Arizona currently from age birth to 21? Maybe 5 to 21, if that helps. Do we know the numbers? Estimates even? Okay, Kendra says there would be multiple databases. Caroline?
Yes, I was going to add, I can get the number of ASA children who are also with ASDB. And Kendra and I, can get that number. But the question is, how many children? We would only know the children who are actually enrolled in ASA. Because what we find, there are many children, as this whole group is about, who are missed. And they may not get services until later.
Yeah. What is the main reason for that?
I think a lot of it is public awareness, child find, underserved area population, and some families who their children may have been identified deaf or hard of hearing or vision loss. They may not want to enroll in early intervention and do things privately.
And Caroline, I'll add to that, if I may, and we spoke briefly about this at the first task force meeting, but we have a very diverse population in Arizona. We have a very rural population in Arizona and it's a question of accessibility in some cases. You have the Navajo Nation that for the last 2 years during COVID has been for the most part shut down, and they don't have the access that the metropolitan areas have to internet. And then you also have families just dealing with basic everyday living needs, Maslow's hierarchy, and the thought of looking into services, it doesn't come before putting food on the table and earning a paycheck and keeping the lights on. So it's a complex issue. There's no simple answer, I don't think.
Thank you for sharing that. That exact kind of thing is should be involved in recommendations, if people aren't having food, are they able to get food services and that kind of thing? Like, we need to look at all of that, not just early intervention. I guess we need to look at all of our partners and advocate agencies and different representatives, that could help us make sure we're supporting our families in those areas. Also, there are other factors also, I'm sure, trust, public awareness, like you mentioned. Yeah, thank you for that discussion. And, I recently learned for that national data, that educational statistics for 2017 showed 350,000 deaf and hard of hearing children in the US. They didn't break down specifically by state, but generally in the US. And it was interesting that 77,000 in IEPs that were in from age 5 to 21. Or before age 5, it's different numbers, but there were 77,000 on IEPs. Maybe some that are not in the educational system, or maybe some are on 504 plans. There was a variety of specifics in the information there, but it didn't have exact information of the data that was collected, but it was interesting. That was 2017. That was data from 2017. 77,000 on IEPs, and it was 13.6% of that number are in IEPs were in deaf schools. 86 were in mainstream public schools, and often they're the only deaf children in that school. And so that's something I just recently learned from the national data. In 2019, again, there's a report published. It says 400,000 deaf children in the US, and only 8.1% go to deaf schools. That was a reduction in 2 years. That meant 91% go to public schools. And most of them are the only deaf children in their schools. And so, wow, that's tough for us to count each of those, in all, if you think about all those different states, do they have deaf schools? Are they on IEPs? And so that's quite a discussion. I remember one university, they had a team member go to a public school, and they knew of two deaf students that were in there, and they went in the principal's office, and they waited for the students to come in, and they said hello, and they were talking to them. And then another student came in, and they were communicating, but they were like, "Are you deaf? Like, wait, why are you here at the school?" And the two of them were having discussion, talking with each other. And it was like, anyways, they were just sitting waiting, and they really didn't even really know each other. They were just thrilled to find out there was another deaf student in the school. And, I think the majority of deaf students or deaf kids may experience that, and to follow that, to provide services and support to all of the deaf and hard of hearing children, no matter what kind of school they go to. It would be interesting to know their language use and, their culture. I don't know, it would be good for us to know, to be able to support those children. I thought that was interesting to see a big change, though, in the numbers from 2017 to 2019 in that published report. So hopefully you'll see another report published and put out soon. So, and that is from the Center of National Educational Statistics of the U.S. Department of Education. That's where that report was from. Okay, I see that the SB 1092 answer is in the chat that Nikki put in there. Yeah, their copy of the bill is put in there. So great. I think that's great for the task force to have access to that bill. And thank you for sending out that information. Maybe you can't see it now, but I'll send it out. So are there any more questions, comments before we wrap things up? Okay, I guess not. So have a great rest of your week, and good luck on your subcommittee work and before the next task force meeting on April 13th. So we'll see you then. And if you have any other questions or you need any support, please don't hesitate to ask and let me know. Okay, thank you so much. Bye-bye. And we can stop the live streaming.